Hello, my name is Richard Williams and I'm the Emeritus Professor of Mental Health Strategy at the University of South Wales. I've been engaged with thinking about disasters and particularly the psychosocial and mental health aspects for more than 20 years. In the current circumstances of the pandemic, clearly a lot of the lessons we've learned from the past are highly relevant, but we're also having to learn new skills given the nature of the current circumstances. My colleagues and I are very keen that the first level of support for staff should come from within their own teams, and that we should support the integrity of teams that work together. With that in mind, my team has prepared a list of 10 messages that we think that teams might wish to discuss and resolve within their own arrangements. And I'll go through those now. The first of those is a reminder to people to be kind to themselves and to one another. I would say that people should be kind to themselves first. And indeed, there is a wider issue here, which is that of remembering that people working in PPE will find communication more difficult. But it is important that staff put themselves first, which is not necessarily the first reaction of healthcare professionals, because unless they are protected, they are taking inordinate risks. The second thing that runs on from that is to recognise that staff will have concerns about the risks they're running. That is inevitable. I think it's best if staff face those concerns by recognising them and being able to discuss them with their leaders and other team members. The injunctions that we are all experiencing about social distancing aren't really about social distancing, but about physical distancing. Indeed, paradoxically, it's important that people do sustain their social connections in circumstances where they're physically more remote from each other. And we think it's important that staff should recognise that and create ways of ensuring that they do that. And that takes me on to the fourth item, which is to recognise that staff will have moral concerns about the experience that they have. They may not, for instance, be able to treat their patients ideally, and especially so when the pressure goes on. And that is a shame, but I think we have to recognise the realities of that. And so that moral distress which comes from those predicaments should also be recognised, I advise, in teams, discussed, and steps should be taken through continuing contact with peers and buddies to discuss those dilemmas. Fifth is a more ordinary, down-to-earth and mundane matter, which is about attending to the basics of life. It's very easy to staff to come off a shift and say, gosh, I haven't had a break in the last 10 hours. And that won't do, I think. The more pressure they're under, the more they must make sure they have opportunities to eat, to drink, to take breaks and rest, but also to sustain their contacts with friends and colleagues about things that are not to do with the pandemic. Sixth, then, I come to a very important matter, which is about staff supervision and relevant training. I'm very keen to recommend and recognise that staff will have continuing needs for supervision and support from their colleagues, and that should be continued rather than reduced during this time of pressure. And indeed, that might be the answer to the next one, which is that to recognise that staff may feel incipiently or actually lonely. They're at the front line working hard, and during that working time, their contacts with other people may be reduced. But it's important to recognise that even though staff are doing an important job and doing things which are vitally important for their patients, that they should not be allowed to feel isolated. Indeed, in terms of ensuring support for frontline staff, leadership and demonstration by example from more senior people is an important commodity. So that support for frontline staff should be visible, available, and continuously monitored. Senior managers should be available to staff. They should be seen to share the risks that everybody faces as is appropriate. Leaders must be continuously available to staff to advise. Next is to recognise the importance of protocols. People will find that what they're being asked to do with patients is perhaps a little different than they might have been asked to do if the circumstances were more ideal. But it's important to understand that those protocols are designed to achieve the maximum benefit for patients, and there may be a very large number of them. So sticking to those protocols gives support, and it gives an opportunity for staff to share how matters are going. Finally, the 10th item is continuing to be aware of guidance. The World Health Organization, for example, issues bulletins, and some of those I think are very useful in recognizing the mental health and psychological strains that fall on people in these kinds of circumstances. But there is guidance that will emerge continuously, I suspect, that will come from the responsible authorities in the UK. Staff should look out for those things and support themselves in that way. I only hope that these 10 items provide an agenda for teams to discuss informally, or perhaps slightly more formally in Schwartz rounds and other types of staff communication. I hope that they help staff to stay well. Thank you.